Hi, I'm Dr. Daniel Friedman, and I'm here with Dr. Salam, who's a postdoctoral fellow at the University of Toronto, and we're talking about the abstract that he's presenting at this year's meeting, titled Comparative Study of Seizure Suppression by Closed-Loop Electrical Stimulation at Earlier and Later Stages of Seizure Formation in two rat models of epilepsy. And I guess to start out with is, can you describe a little bit about what your stimulation model is and how is it different from other brain stimulation models for epilepsy?
Yes, definitely. So our electrical stimulator is a closed-loop stimulator, which is stimulate only if device detect seizure onset. And our devices look like that, and it is based on a really small microchip built inside, and it is inductive power. And one important thing I could say which differentiate a lot from other closed-loop stimulator is our system we call seizure abortion, not seizure stop. Most of the electrical stimulator we have commercially, they use seizure stop because they see seizure in the EEG and then stimulate to stop. However, our system detect 20 seconds before seizure formation and stimulate a small current which abort the seizure, not stop the seizure. So important thing is when you see a seizure in the EEG, it's already developed. And if you apply current, small current, it doesn't stop. It requires big current to stop it. However, if you're a little bit early, you need a really small current to stop the seizure formation. And we used we use 100 micron current, and according to our estimation, this kind of device lasts for 35 years without any battery charge. Moreover, that thing has an inductively power charging. Every time like you go to the sleep, it automatically recharge your battery full.
And so what signals are you using to determine the early or pre-seizure interval?
So we are using intracranial EEG. So we implant two electrodes, one electrode in the one side of the brain, another electrode in the another side of the brain. So what happens is we see synchronization between two hemispheres of the brain. Generally, in the normal state, both sides of the brain is synchronized, that they communicate each other really in a harmonic rhythm. However, if in the seizure formation, where one side of the brain where seizure focal is oriented, it started to hyperactive, and other side is kept normal, and then we see the desynchronization, really deep desynchronization. And later on, when seizure spread to the other side, we see hypersynchronization. So there's two spots to stimulate. If you stimulate on the desynchronization, you stop the seizure right away with a small current. However, if it is spread to the other side, you see super synchronization in between two hemispheres, then you need a big stimulation to stop it. So in our study, we showed that if you stimulate at the early period of the seizure formation, and if you stimulate later period of the seizure formation, and what happened, we see significantly seizure suppression on the early stage of stimulation rather than the later stage.
So late stimulation using these small currents has no effect?
No effect.
And what models of epilepsy did you play this in?
So far we have tried on two models, acute model and chronic model. Acute model is for a minute period. We induce seizure for 2 hours. One group, we see number of seizures per hour, and another group, we try to stop and compare how many seizures we stop. And in the chronic model is a month long. We inject cyanuric acid, and in a 2-3 months, seizure develop, and that seizure lasts forever for their lifetime. In that situation, when a seizure develops, we have different period of time, different phase. At the beginning, we don't stimulate. We see number of seizures. In the second phase, we turn on the device 1 to see how many seizures it reduced, and then we turned off the device again. And then after a certain period, we turn on the device 2 to see how many seizures reduced. So device 1 in our abstract is early stimulation, and device 2 is a kind of late stimulation, 2 second after when you see the seizure. And early stimulation, you mean it's an early formation. In the EEG, you don't see the high amplitude seizure yet.
So what do you think are the next steps in your research if you want to get this, to patients with treatment-resistant epilepsy down the road?
Yes, so actually we kind of impress our local government. We are from Toronto, and our provincial government, Ontario Brain Institute, they're funding us to try it on a human.
Okay.
And we are calling it mini clinical trial. We'll be trying on about 20 patients in Toronto Western Hospital. So let's see what is happening.
Okay, great. When can we look forward to some results?
Next year probably.
Okay, great. Thank you.
Thank you.